The Inflation Reduction Act passed last week. Now, the question you probably have is, why is the health insurance savant talking about inflation reduction? Hi, I'm Kenneth Wright, and I am the health insurance savant. And the reason I'm talking about the Inflation Reduction Act is because within that act, there are a number of things that impact healthcare costs and coverage here in the United States. So what are those things? Probably the most important thing for our senior population is regulations regarding Medicare. Finally, the government has been able to pass a bill that allows Medicare to negotiate with pharmacies and, more importantly, to negotiate with pharmacological companies. And what that means is beginning in 2026, you will start to see a gradual reduction in some costs for prescription drugs. This is only for the Medicare market. This was not passed for the private market, but it is a big step forward. Now, for the people in my wheelhouse, which are people under 65, the big news is the big subsidies that were added during the COVID years, which increased subsidies by a large amount, will continue at least until 2025. Why is that important? Because if that law was not passed, those of you getting subsidies out there could look forward to up to a 53% increase in your insurance premiums beginning in 2023. So the Inflation Reduction Act is not only impacting climate change issues that you've been hearing about in the news, but very substantially medical issues and medical health care. Again, prescription coverage for seniors under Medicare, and then number two, subsidies under the Affordable Care Act. So if you have any questions about how this impacts you specifically, reach out to me. I'm Kenneth Wright, the health insurance savant. I can be reached on Instagram, LinkedIn, subscribe to our YouTube channel, and remember, why use an agent when you could choose the savant?